Hey, I'm Alexis, and I'll be demonstrating how to insert an NG tube, remove an NG tube, and discussing some types of feedings that you could receive with an NG tube. So the first thing I'm going to do is I'll get the order from the doctor to insert the NG tube. So the doctor can order NG tube for many different reasons. Some reasons might be that the patient has a GI bleed, they could have a GI surgery, they could have some esophageal trauma that could be causing some malnutrition, and there's many different reasons for it. This patient is malnourished, so we're getting this so we get some feeding started. So I check my orders with the physician, and then I check the patient. Yes, this is Mr. Patient. Yes, Mr. Patient, you will be getting an NG tube today. Gathered all my supplies already, perform hand hygiene, and put on my gloves. Okay, and I would assist my patient to high Fowler's position. And I will gather an Emerson's basin, a facial towel, and some ice chips for them to swallow if they can. Okay, I'm gonna go ahead and I'm gonna check the nair to make sure they can breathe with one occluded. Okay, patient is good. So I'm gonna go ahead and start measuring the tube. Okay, I'm measuring from the nair to the ear, the xiphoid process. Okay, I'll mark this with a piece of tape. Okay, now I will apply lubricant 3 to 4 inches. Good, and I'll throw that away. Okay, now this is the part where I will tell you to swallow when I go to insert it, okay? Are you ready? And swallow for me. Now I'm pushing it down and back. Keep swallowing for me. Almost done. Just keep swallowing. Okay, and then we're at the tape, so we're gonna go ahead and temporarily secure it to their nostril. Okay, so we would check placement by getting some residual and checking them with pH strips, and then after that I will send my patient down to get a chest x-ray. The patient has now returned. Chest x-ray is good, placement's good, everything. He has not had any complications. If he did, I would discontinue the NG tube, but in this case he tolerated very well. So placement's good and everything's good. So I'm gonna go ahead and take my gloves off, perform hand hygiene. I'll document the size and type of the tube. I would document how the patient tolerated it. I would document which side of the nose we went in, which nair. Also document what the residual looked like, document how they tolerated it, and all that stuff. So at this point, we will have them connected to the feeding if that's what the doctor ordered, or you can connect it to suction or whatever the doctor ordered for this patient. For this patient, we did do feedings. So this part I'm gonna tell you a little bit about feedings. So you have 3 different types of feedings. You can do a bolus, you could do gravity, and you could do a pump. So with gravity, you put the feeding in a feeding bag and you'll let gravity pull it into the NG tube and feed and deliver the feeding. So with bolus, you'll pull up a certain amount that the doctor orders and you will push it into the NG tube by a syringe. And then with a pump, you can have a kangaroo pump and you attach the feed into it and it attaches to the NG tube and it delivers a set amount, like per hour or over a certain amount of time, and the pump will do all that. I have returned to Mr. Patient's room with the new order that he would get enteral tube feedings. I'm going to verify my order with the MAR, verify that this is Mr. Patient, and he has stated that he does not have any allergies. The MAR states that he does not have any allergies as well. So I go ahead and set him up in high Fowler's position. I'm going to do hand hygiene. I'm going to don my clean gloves. Okay, now I'm gonna go ahead and prepare his tube feeding material. So this is his feeding. It's not expired. I'm gonna go ahead and shake it and pour it into his feeding bottle. Okay, make sure I connect my tube in, and I'm gonna go ahead and prime it. Let it drip into the trash can. So we're primed and ready to go. There's no air in it. Okay, so the next thing I'm gonna do is check the residual. Okay, he has less than 250, so I will reinsert it into the tube. If he had greater than 500, Then we would discontinue the tube feeding, or if he has greater than 250 on 2 different counts, an hour apart, we will also discontinue at that point too. But he did not, so we are going to take some water and we will flush his tube with 30 milliliters of water. So flush, he's tolerated it well. Okay, so after everything is set up, I'm gonna go ahead and hook him up to his tube feeding. Okay, he is hooked up. I turned on the pump. He is getting a continuous feeding through a pump. So for his case, we will go ahead and flush it every 4 hours with 30 milliliters of water. And we also will flush, if he was getting like a bolus, you would flush before and after. But since he's not, we're just gonna flush it before and flush it every 4 hours. And you always make sure you flush with at least 30 milliliters of water. And you also wanna make sure you check his residuals every 4 to 6 hours, or per your agency's policy. Make sure you change out your feeding tube, your feeding bed, and the whole setup at least every 24 hours. And you also, if he had an abdominal tube, you want to make sure you clean that site daily. He has an NG tube, so we will assess it, make sure there's no complications. We don't see any complications. So we're going to go ahead and take off these gloves, throw those away, perform hand hygiene, and I will document the procedure, how they tolerate it, how much residual, what it looked like, what his site looked like. If he had any nausea or vomiting during procedure, we will also document that, and you want to make sure you document your I and O per your agency's policy. That's it. So now the doctor has ordered for this patient's NG tube to be removed. So I'm gonna verify my order, and I'm gonna verify my patient. Yep, this is Mr. Patient. Mr. Patient, we will be removing your NG tube, okay? So I'm gonna go ahead, hand hygiene, and put on new gloves. Okay, we got our patient draped already. I'll have an emesis basin just in case. And to remove this, I will ask you to hold your breath for a second, but I will tell you before we do that, okay? So I'm gonna disconnect this from any suction or feeding tube that it's hooked up to. And I will go ahead and pull the tape off of your nose. Okay, now this is the part I'm gonna ask you to hold your breath. Ready, and hold your breath, and remove. Go ahead, get rid of that. And I will clean up my supplies, take off the drape. And I will provide nasal care and oral care as needed to make sure the patient can still breathe and no leftover residue. So then we're all good. The patient, he has no complications. So we're going to go ahead and take off the gloves. I'm going to perform some hand hygiene, and I will document the procedure and how the patient tolerated it.